Hi, hello everyone. Today we will discuss automatic tissue processing. Tissue processing. It is a procedure which needs to take place after gross examination between the tissue fixation and embedding and then sectioning of the paraffin blocks. It is called tissue processing. There are mainly two steps in the preparation of a slide. One is sectioning of the tissue and the other is staining of the tissue. Sectioning of the tissue is two types: frozen sectioning, paraffin sectioning. Staining of tissues is two types: routine stains and special stains. Routine stains done by hematoxylin and eosin HND stain, Papanicolo staining by PAP stain. Special stains include PAS stain, periodic acid skip stain, AFB stain, acid fast bacilli stain or Gill-Nielsen stain, Rocode stain, argentafin stain, argyrophilic stain, amyloid stain, reticulin stain, trichrome stain, PTAH stain, Fontana-Mason stain, Van-Cosa stain, oil red O stain, mucin stain, Giemsa stain, elastic stain, and myelin stain. Frozen sectioning. It is a rapid way to fix and mount histology sections using a refrigerating device called as cryostat, a modified rotatory microtome housed in a refrigerated cabinet. The temperature can be controlled within minus 15 degrees centigrade to minus 20 degrees centigrade. The microtome is remotely operated from the outside. Freezing technique. Dry ice, carbon dioxide solid CO2 mixed with acetone with high pressure. Liquid nitrogen, isopentene cooled in liquid nitrogen. Cold contact, refrigerated test tube. Commercial sprays, thermomodulate attachments. Uses: urgent diagnosis to detect whether a breast nodule is benign or malignant, to decide whether lumpectomy or mastectomy to be done. It is to prevent dissolution or destruction of substance need to be examined. Example: demonstration of a fat in liposarcoma by Sudan Black B. Enzyme ATPase NADPH in muscle biopsy for enzyme histochemistry. It is for immunofluorescence studies like renal and skin biopsies to demonstrate deposit of the antibodies, complements, fibrins, and another antigen. It is used for silver and gold impregnation methods in neurohistopathology, and it is also useful in to see the excision margins whether it is free or invaded by the tumors. Diagnosis of Hirschsprung disease or congenital megacolon in neonates and children is also done using this frozen sectioning. Coming to paraffin sectioning. Tissues from the body taken for diagnosis or disease processes must be processed in a histopathology laboratory to produce microscopic slides that are viewed under the microscope by a pathologist. The person who do the tissue processing and make the glass microscopic slide is called as histotechnologist. Paraffin sectioning can be done in two ways: automatic tissue processing and manual tissue processing. Automated tissue processing specimen numbers will be high. Manual tissue processing specimen numbers low to high. Tissues that come to the histopathology laboratory are biopsy specimens like endoscopy, colonoscopy, cervical biopsy. Resected diseased organs like gallbladder, uterus, breast, intestine, bone, cartilage, soft tissue, etc. Resected organ or tissue after chemotherapy or radiotherapy. Forming cell block from FNAC. Autopsy specimens. Animals like mouse. Specimen accession. Tissue specimen received in the surgical pathology have a request form. List the patient's information and history along with the description of the site of the origin. The specimen is accessioned by giving them a number that will identify each specimen for each patient and maintain in a register. Cross examination. Tissue removed from the body for diagnosis arrive in pathology department and are examined by a pathologist. When a malignancy is suspected, then the specimen is covered with ink in order to mark the margins of the specimen. Different colored inks can be used to identify the different areas if needed. When section is made and processed, the ink will mark the actual margins on the slide. Cross-examination consists of describing the specimen and placing all or parts of it by cutting a sharp knife in case of soft tissue or by a saw in case of hard tissues like bones or cartilage into small plastic cassette which holds the tissue. Initially, the cassettes are placed in a fixation. Fixative is a chemical substance which preserves the architecture of the tissue near normal by killing the cells before enzymatic degradation by cellular enzymes. Fixation done in a fixative for 12 hours. Factors that affect fixative are buffering, penetration, volume, temperature, concentration, and time interval. Fixatives generally used for soft tissues are 10% formalin for all routine surgical pathology and autopsy tissues. Anchors fixative for reticuloendothelial tissues including lymph nodes, spleen, thymus, and bone marrow. Bounce fixative for testes, gastrointestinal tract, and endocrinal tissues. Tetraldehyde for electron microscopy. Corners fixative for early fixation within 6 hours, and universal fixative for DNA preservation. Fixatives that are used for hard tissues, decalcifiers. Some tissues contain calcium deposits which are extremely firm and which will not section properly with paraffin embedding, owing to the difference in densities between the calcium and paraffin. Decalcifiers are used to remove the calcium ion from bony tissue, and they are strong mineral acid, nitric acid, and hydrochloric acids, bioorganic acids such as acetic acids and formic acid. DTA electrolysis. Endpoint of decalcification. Decalcification is completed if specimen is floating. Ending of a specimen is possible if decalcification is completed. Inserting a pin or nail is possible if decalcification is completed. Manual tissue processing. Dehydration. The water from the tissue must be removed by dehydration, and this is usually done by 1 hour 30 minutes. Each series of alcohols from 70%, 80%, 95% alcohols. Clearing is done consists of removal of dehydrate with a substance that will miscible with the embedding media. The commonest clearing agent used is toluene. Tissue placed in toluene 1 and toluene 2 each for 30 minutes. Other clearing agents that are used are xylene, chloroform, paraffin, methyl benzoate, methyl salicylate, and citrus. Infiltration. Tissue is then infiltrated with embedding agents like molten paraffin wax in a beaker placed in a hot air oven for 6 to 8 hours, which replaces the toluene. Other infiltrating media that are used are Paraplast Plus, gelatin, pyridine, epoxy resin for electron microscopy, and acrylic resin for immunohistochemistry. Automated tissue processing is the above process consisting of dehydration, clearing, and infiltration, and are almost always automated for large volumes of routine tissue processed. Automation consists of an instrument that moves the tissue around through the various agents on a present time scale. Embedding. After tissues have been dehydrated, cleared, and infiltrating with embedding materials like paraffin, agar, gelatin, which is then hardened. This is achieved by placing tissue in a metallic angle or L molds, Leucart's molds, and cooling in cases of paraffin and heating in case of epoxy resin for electron microscopy and acrylic resins for immunohistochemistry. In case of automated tissue processor, tissues are still in the cassettes and pick the tissue out of the cassettes and pour molten paraffin over them using L mold. Sectioning. The blocks are then chilled in a tray of ice because the cold wax makes a clean cut compared to paraffin wax cut at room temperature. The paraffin block is cut by using a rotatory microtome with a 4 to 5 micrometer thickness. Biosectioning. In case of frozen section, fixed or unfixed frozen tissue sliced by using microtome maintained in a refrigerator device known as cryostat. Labeling. For indefinite storage of block, a identification number is written by Indian ink on a small piece of paper and attached. This is one side of the block. Butterworthing. After sectioning, the sectioned tissue placed in warm water bath to float that help to remove the wrinkles, making slide and numbering. Section tissues pick up on a glass microscopic slides from water bath and are placed in a hot air oven for 15 minutes to help the sections adhere to the slide. The slide is then numbered by using non-removable ink. First, clearing. Rinse in xylol for 10 dips to remove wax. Then rinse in graded alcohols 70%, 80%, 95%, 5 dips each to remove the xylol. After staining, the slides are dried using blotting paper. Stained sections on the slides must be covered by a thin piece of plastic or glass with DPX to protect the tissue from being scratched, to provide better optical quality for viewing under the microscope and to preserve the tissue section for years to come. Drying. Then the slide dried in hot air oven for 5 minutes. Microscopic examination. Stained slides then examined by a pathologist, and pathologist should write the report in a register. The last step including entering the case into a computer database and printing the labels is signing off. Then label the slide and deliver the book of the slide to assigned pathologist.